Hi guys, my name is Kara and I am going to be sharing with you guys today my experience as an occupational therapy student and hopefully provide some more information about the profession as you all are considering what you would like to go into with your career in the future. So first, a little bit about me. Like I said, my name is Kara. I graduated from Southern Illinois in December of 2020 with my Bachelor's of Science in Exercise Science. So this picture here is me on graduation weekend in front of Davies doing a little celebratory hop. I'm currently a first-year student at Washington University School of Medicine in St. Louis in the program in occupational therapy. And I realized when I was at Southern that I think I was the only person currently in the program that was going into OT. And I would like to share what the profession's all about with you guys so that you guys can consider it moving forward, because it is such a wonderful career to be a part of that does so many cool things. And a lot of you may not be aware, so I wanted to spread the word. So I think it's always good to start with the basics. So what is occupational therapy? Some of you may already know, but for those of you who don't, OTs help people participate in their desired occupations with the therapeutic use of everyday activities. And these are based on a client's personal interests and needs. OTs consider the relationship between the person, the environment around them, and the skills that are needed to engage in meaningful occupations. This definition is still really broad, so hopefully in the next few slides I can provide some more context that helps you understand what this actually looks like in practice. Do you want to help people engage in activities that are important to them that they're experiencing difficulty with due to injury, disease, or disability? If so, I want you to consider occupational therapy as a profession. I think when you look at this first statement that there's a lot of professions that you could attribute this desire to, especially like medicine, nursing, physical therapy. But I think this definition really defines OT to its core when an individual is experiencing disruption in not only the things they need to do, but the things that they want to do. OTs are at the forefront to provide them with the tools and resources and support to make sure they can still perform and participate in the things that make them who they are. Now you might be thinking, after all of this definition and description, what is an occupation? I think that's probably one of the most commonly misunderstood things about occupational therapy is that we help people get jobs. But we don't see occupation in the sense of like vocation. Definitely like working is an occupation, but we see occupation as anything that you do to fill your time that is meaningful or necessary to how you live your everyday life. So OTs use the occupational therapy practice framework to define our scope of practice. And this document that is updated periodically as the scope of practice changes defines the 9 domains of occupations as the following. So activities of daily living, instrumental activities of daily living, health management, rest and sleep, education, work, play, leisure, and social participation. There's a bunch of other subcategories that fall under these 9 domains, and certain occupational therapists can specialize in certain categories. But this is kind of how we classify the different areas of one's daily life that OTs are trained and suited to provide evaluation and intervention for when they are experiencing a challenge. So this slide is to demonstrate the many practice areas where OTs are trained and qualified to provide services. This list is not exhaustive. This is just the first 12 settings that popped into my head when I was making this chart. Just to demonstrate that there are so many options based on your own personal preferences and interests. So some examples are academia, mental health services, school-based OT, universal design and real estate, pelvic floor therapy, and these are just to name a few. You'll get to explore these settings through fieldwork during your didactic learning in OT school, and then you get to do a fieldwork experience to kind of cap your education, where you get to engage in one of these settings for 3 months, and then another 3 months, it's 6 months total, to develop the skills that are needed to be an entry-level OT. So this slide obviously is not all encompassing of everything it takes to become an occupational therapist, but these are kind of the big three. So OTs are required to have either a master's or doctoral degree from an accredited institution. The only difference between doctors and masters, they're both considered entry-level degrees, but the doctoral degree allows for exploration in areas like academia and research. OT students also have to complete 2 3-month-long fieldwork experiences for degree completion. So fieldwork essentially is considered like your clinical rotations, residency, internship, where you get to develop the skills that are necessary to enter the profession once you're completed. So I will be doing my fieldwork placements in Portland, Oregon in adult acute care on a specialty floor in a hospital there, and then also in outpatient neuro rehab working with individuals who have experienced stroke or TBIs or individuals with Parkinson's or Alzheimer's, and I am super excited about that. And then finally, you have to take and pass the MBCOT, which is the board examination for occupational therapists in order to become registered. You only have to take it one time, and then you are good to go. But there's continuing education units requirements that vary state by state in order to maintain your licensure. Occupational therapy at its core puts occupation as the focus. So this is where the delineation happens between OTs and PTs. So if you think of someone having weak quad muscles, a PT might say, okay, you have weak quads, let's do some structured exercises to increase the strength of your quads. If a client, for me as an OT, had weak quads, I would say, okay, what occupations in your daily life require your quads to be strong? And how can we improve your participation? So someone might have stairs in their house, and in order to increase their quad strength, we might practice doing some stair climbs, or they may need quad strength to sit to stand from the toilet or the couch. So we'll practice going from sit to stand in order to increase their strength. So there's 2 approaches to addressing the same issue. OTs just frame it in a more personal context of improving that quad strength that directly relates to the way in which someone lives their unique and individual lives. Occupational therapy at its core is also an evidence-based practice. So OTs generate and utilize research to inform best practice. So our interventions and treatment are based in what the evidence says is safe and effective in improving our clients' conditions and promoting the best outcomes. Occupational therapy at its core is also emphasizing client-centered care. So we have to really think about what is important to this client and put aside our own preconceived notions. Clients might engage in activities that I might not find personally meaning, but they find it personally meaning, so I need to do what I can to make sure that they can participate in those things to their fullest extent in order to live a meaningful life. So this is a quote that I like to share with folks when I'm trying to convey what OT is and what purpose we serve. So the quote is, "Life is made up of a few moments all strung together like pearls. Each moment is a pearl, and it is up to us to pick the ones with the highest luster. If we do not have time to do great things, take a few gentle moments and do small things in a great way." So I think this kind of shows that OTs can help individuals who may be experiencing a really tough time due to injury or a condition or disability that might feel like they don't have time to do great things, make adaptations and compensations so that they can do small things in a great way that adds meaning to their lives. So that is my whole spiel, guys. I am so grateful for you guys for listening and grateful to Dr. Anton for letting me share this with you guys. I could talk about OT forever and ever, but I know you guys have class to get to. So if you'd like more information about OT or the school application process or anything else, I would love to connect and chat with you guys. My phone number and email address are on the screen. Please use my phone number judiciously. Please don't call me in the middle of the night, but send a text and I would love to connect and talk with you guys. Thanks.